All right, this is Tyler McNeil, and the shortened title for the presentation is COVID-19 vaccination rates. So to jump right into it, my research question is, why is it that African Americans are receiving less vaccines than white Americans? Now, I decided to research this because I had read an article saying that this was happening in the Valley, and after a little bit of research, I found that this was a nationwide issue. With my methodology, I decided to go with in-depth interviews with two notable members of Roanoke City Society. Now, I chose this method because my assumption was that they would have a better understanding about what is really going on with this COVID-19 vaccine. Now, my first interview was with Dr. Nancy Odell. She headed the initial COVID-19 response for the Allegheny region, and this region just includes Roanoke City and Salem as part of some of the cities that are involved. Now, the second person I interviewed was Dr. Brenda Hale. Now, she essentially heads up the Roanoke City chapter of the NAACP and is also incredibly vocal in the region. For the first interview, I went with a phone call. In the second interview, I went with a Zoom meeting. All right, now we can take a look at my key research findings. Now, I came up with two main takeaways from my research. One is that there is a general lack of information with regards to the COVID-19 vaccine. Now, one example of this is difficulties receiving health care. Now, healthcare officials are great sources of health-related information, such as the vaccine. Now, healthcare is incredibly expensive, especially so in America, and in many cases, it just cannot be afforded. Now, this is also the same case for things like the internet, as the internet is a great source of information. Now, the second main takeaway is just a general distrust of the government. Now, to be more specific, I want to take a look at Donald Trump. Now, he is known for his racist rhetoric, and this just does a good job at pushing away people of color. Right? So how could you trust the government that funded the vaccine if you can't even trust the administration that funded it? Now, for my final main section, we can take a look at class concept. Right? Now, one clear point, something we've been over in the class fairly often, is that race is a social construct. Um, However, it does have very real effects. Now, race is a social concept that is used to oppress people of color and simply has been used since colonial times. Specifically looking at my project, racial discrimination can lead to poverty, right? Uh, which, like previously stated, can lead to inability to access information about COVID-19 vaccines, right? Healthcare and internet can just be incredibly expensive. So, poverty can cause some serious issues when it comes to healthcare. Uh, the second main class concept that I'd like to cover is the othering of groups, or in this case, social groups. Like previously stated, Donald Trump and his administration has othered people of color. And once again, this causes just general distrust of his administration and thus the government that funded the COVID-19 vaccine. Now, the final main class concept that I want to take a look at is poverty. Um, Now, this cycle is quite vicious. Once again, it's a learned cycle that can spread through generations. However, it can also lead to vaccine hesitancy, right? If you are struggling to find a job, or you are constantly worrying about where to get your next meal, um, you know, chances are you're likely not, looking for access to healthcare or internet. In this way, just to access information related to the COVID-19 vaccine. Now to finish things up, I just like to go over the discussion question that I ended up not being able to give out to the class. Now, what are some negative impacts that othering can have? One example I was prepared to give the class was that I'd read an article about healthcare and how quite often people of color and women were commonly othered when receiving healthcare, and their problems could have been considered of less importance than other people's problems, which once can clearly can impact somebody's health if they're not receiving the proper care that they should be. Thank you for listening.